Question 1. A 65-year-old male is seen for uncontrolled hypertension and chronic kidney disease, stage 4. Documentation states the chronic kidney disease is due to the hypertension. A. I10, N18.4. B. N18.4, I10. C. I12.9, N18.4. D. I13.11. Answer: C. I12.9, N18.4. This question tests the sequencing of codes when hypertension causes chronic kidney disease. The keyword due to indicates a causal relationship between the hypertension and the chronic kidney disease. ICD-10-CM guidelines require coding the hypertensive condition first when a causal relationship with chronic kidney disease is documented, and combination codes like I12.9 exist for this specific relationship, followed by the code for the stage of chronic kidney disease. Therefore, I12.9 captures the hypertension and stage 4 CKD, and N18.4 is also needed to fully specify the stage. A good way to remember is that when hypertension leads to CKD, the hypertension code, specifically the combination code, comes before the CKD stage code. Question 2. A patient presents with a non-displaced spiral fracture of the shaft of the right tibia due to a fall while hiking. This is the initial encounter for this fracture treatment. A. S82.221A, W18.09XA, Y92.89. B. S82.221A, W18.09XA, Y92.313. C. S82.224A, W18.09XA, Y92.313. D. S82.221A, Y92.313, W18.09XA. Answer: B. S82.221A, W18.09XA, Y92.313. This scenario requires coding a specific fracture, an external cause of injury, and the patient's activity and location at the time of injury. The keywords spiral fracture, right tibia shaft, fall while hiking, and initial encounter are crucial. You must select the correct fracture code indicating laterality and the initial encounter, then add the external cause code for the fall and codes for the place of occurrence and activity, all with the appropriate 7th character. The correct fracture code for a non-displaced spiral fracture of the right tibial shaft, initial encounter, is S82.221A, and the external cause codes should follow the injury code. Remember to capture all relevant details including laterality, type of fracture, initial encounter, cause, and location. Question 3. A patient is diagnosed with stage 3 chronic myeloid leukemia, CML, with blast crisis. A. C92.10. B. C92.12. C. C92.11. D. C92.19. Answer: C. C92.11. This question tests your ability to code specific types and stages of leukemia. The key information is chronic myeloid leukemia, CML, and blast crisis. The ICD-10-CM alphabetic index directs you to codes that differentiate CML based on the stage, such as chronic phase, accelerated phase, or blast crisis. C92.11 is the specific code for chronic myeloid leukemia, blast crisis, which accurately reflects the patient's condition as documented. Always look for specific terms like blast crisis when coding leukemias, as they significantly impact code selection. Question 4. A patient presents with severe sepsis due to methicillin-resistant Staphylococcus aureus, MRSA, pneumonia. A. A41.9, J15.212. B. R65.20, A41.9, J15.212. C. A41.9, R65.20, J15.212. D. R65.20, J15.212. Answer: D. R65.20, J15.212. This question involves coding severe sepsis due to a specific infection. The keywords are severe sepsis, due to MRSA pneumonia. ICD-10-CM guidelines require coding the underlying infection first, followed by the code for severe sepsis, R65.2, if the documentation specifies severe sepsis and does not mention associated organ dysfunction. In this case, J15.212 for MRSA pneumonia is the underlying condition, and R65.20 is the code for severe sepsis without septic shock. The guideline for coding severe sepsis is crucial here. The code for severe sepsis itself, R65.2-, is sequenced before the localized infection. Question 5. A patient is seen for follow-up care of a healed traumatic fracture of the left radius that occurred 2 years ago. The fracture has fully healed, and the patient is experiencing no current symptoms. A. S52.502S. B. Z09. C. Z87.311. D. M84.852A. Answer: C. Z87.311. This question tests coding for a personal history of a healed condition. The keywords healed traumatic fracture, 2 years ago, and no current symptoms indicate that this is not a current injury or a sequela, late effect. When a patient is seen for follow-up after a fully healed injury with no residual problems, the appropriate code is usually from the personal history chapter, Z87. Z87.311 specifies a personal history of a fracture, appropriately reflecting the situation. Remember to use Z codes for personal history when the condition is no longer present and there are no lingering issues. Question 6. A 45-year-old female with type 2 diabetes mellitus is diagnosed with diabetic retinopathy and diabetic polyneuropathy. A. E11.319, E11.42. B. E11.21, E11.42. C. E11.42, E11.319. D. E11.319, E11.40. Answer: A. E11.319, E11.42. This scenario involves coding multiple manifestations of diabetes. The keywords are type 2 diabetes mellitus, diabetic retinopathy, and diabetic polyneuropathy. ICD-10-CM guidelines state that when coding diabetes with manifestations, the diabetes code comes first, followed by codes for the manifestations. Code E11.319 covers type 2 diabetes with retinopathy, and E11.42 covers type 2 diabetes with diabetic polyneuropathy. These are the most specific codes given the information. Always sequence the underlying diabetes code first when coding its associated complications or manifestations. Question 7. A patient has chronic pain due to cervical spinal stenosis. The patient is receiving pain management. A. M48.06, G89.29. B. G89.21, M48.06. C. M48.06. D. G89.29. Answer: B. G89.21, M48.06. This question involves coding chronic pain related to an underlying condition. The keywords are chronic pain, due to, and cervical spinal stenosis. ICD-10-CM guidelines specify that when chronic pain is documented and is associated with a specific site or condition, and the reason for the encounter is pain management, the code for the specific site or condition is followed by a code from category G89 to specify the type of pain. However, if the reason for the encounter is pain control or management, the pain code G89 is sequenced first, followed by the code for the underlying condition. G89.21 is the code for chronic pain that is malignant or due to trauma/injury, often applied in pain management scenarios where the underlying cause is structural, followed by M48.06 for spinal stenosis in the cervical region. Therefore, the G89 code comes first when pain control is the focus of the visit. Question 8. A patient is diagnosed with acute exacerbation of chronic obstructive pulmonary disease, COPD. A. J44.0. B. J44.1. C. J44.9. D. J44.0, J44.1. Answer, B, J44.1. This question tests the use of combination codes for conditions with acute exacerbations. The keywords are acute exacerbation and chronic obstructive pulmonary disease, COPD. ICD-10-CM provides combination codes that capture both the chronic condition and its acute exacerbation in a single code. J44.1 is the specific code for chronic obstructive pulmonary disease with acute exacerbation. Using a single combination code is more specific and preferred over coding the chronic condition and the exacerbation separately when a combination code exists. Question 9. A patient presents with a suspected transient ischemic attack, TIA. The physician orders diagnostic tests to rule out a stroke. A. G45.9. B. I63.9. C. R29.898. D. Z03.89. Answer, A. G45.9. This scenario involves coding a suspected condition for which diagnostic testing is being performed. The keywords are suspected transient ischemic attack, TIA, and rule out a stroke. When a diagnosis is listed as suspected, possible, probable, or rule out in the outpatient setting, you should not code the suspected condition. Instead, you code the signs and symptoms or the reason for the encounter, unless an established diagnosis is confirmed. In this case, however, G45.9 is the code for transient ischemic attack, unspecified, and is often used when TIA is the working diagnosis requiring investigation, even if not yet definitively confirmed. Outpatient coding guidelines differ from inpatient coding regarding rule-out diagnoses. For outpatient encounters focused on investigating a suspected TIA, coding the TIA is appropriate. Question 10. A newborn, born 3 days ago, is being treated for neonatal jaundice due to ABO isoimmunization. A. P59.2, P55.1. B. P55.1, P59.2. C. P59.9. D. P55.0, P59.2. Answer, A. P59.2, P55.1. This question involves coding conditions originating in the perinatal period, specifically neonatal jaundice due to a specific cause. The keywords are newborn, neonatal jaundice, and due to ABO isoimmunization. ICD-10 CM guidelines for the perinatal period, P codes, state that when a condition originates in the perinatal period, birth through 28 days after birth, a P code should be used. P59.2 is the specific code for neonatal jaundice due to other and unspecified hemolytic diseases, and P55.1 is for ABO isoimmunization of newborn. The jaundice, P59.2, is the manifestation of the isoimmunization, P55.1, so the jaundice code is sequenced first. Question 11. A patient is admitted due to acute kidney failure following a contrast media reaction during a radiology procedure performed 2 days prior. A. N17.9, T78.40XA. B. T78.40XA, N17.9. C. N17.9, L50.9, Y60.0. D. T78.40XA, N17.9, Y60.0. Answer, B, T78.40XA, N17.9. This scenario involves coding a complication of medical care. The keywords are acute kidney failure, following, contrast media reaction, and radiology procedure. When a complication arises from a medical procedure or substance, the complication code is typically sequenced first, followed by the nature of the complication and then potentially external cause codes. T78.40XA is the code for allergic reaction, unspecified, to unspecified drug, medicament or biological substance, initial encounter, which captures the contrast media reaction. Acute kidney failure is coded with N17.9. The guideline for complications requires coding the nature of the complication, the reaction, first, followed by the resulting condition, kidney failure. Question 12. A patient presents with severe malnutrition secondary to chronic pancreatitis. A. K86.1, E43. B. E43, K86.1. C. E46, K86.1. D. K86.1, E46. Answer, B, E43, K86.1. This question tests coding a condition that is secondary to another. The keywords are severe malnutrition, secondary to, and chronic pancreatitis. When one condition is documented as being secondary to another, the code for the condition that is secondary, malnutrition, is typically sequenced first, followed by the code for the underlying cause, pancreatitis. E43 is the code for severe protein-calorie malnutrition, and K86.1 is for other chronic pancreatitis. Code severe malnutrition first, as it is the condition being treated, followed by the underlying cause. Question 13. A patient is seen for management of uncontrolled essential hypertension with benign prostatic hyperplasia, BPH. A. I10, N40.0. B. I10. C. N40.0, I10. D. I10, N40.1. Answer, A. I10, N40.0. This question involves coding two coexisting conditions that are not causally related. The keywords are uncontrolled essential hypertension and benign prostatic hyperplasia, BPH. When a patient has multiple diagnoses that are not linked by due to or similar causal terms, you code each condition separately, and the sequencing depends on the reason for the encounter and coding conventions. In the absence of specific sequencing instructions linking these two conditions, they are typically coded in the order of severity or focus of treatment, or simply as listed. I10 is for essential, primary, hypertension, and N40.0 is for benign prostatic hyperplasia. Code each condition separately when no direct causal link is documented. Question 14. A patient requires follow-up care for a surgical wound infection at the site of a recent appendectomy. A. T81.4XXA, K35.80. B. K35.80, T81.4XXA. C. T81.4XXA, Z09. D. K35.80, L03.311. Answer: A. T81.4XXA, K35.80. This question tests coding complications of surgical procedures. The keywords are follow-up care, surgical wound infection, and recent appendectomy. When coding complications of surgical procedures, the code for the complication itself, e.g., infection, is typically sequenced first, followed by a code that identifies the site and nature of the complication, if not included in the complication code, and potentially an external cause code if applicable. T81.4XXA is the code for infection following a procedure, initial encounter. Even if it's follow-up care for the infection, the complication is still in its initial phase of treatment. K35.80 is the code for acute appendicitis, unspecified, which represents the reason the appendectomy was performed, providing context but is not the primary code for the current encounter, which focuses on the infection. The complication code related to the procedure site is sequenced first. Question 15. A 70-year-old patient presents with dementia with behavioral disturbance due to Alzheimer's disease. A. F02.80, G30.9. B. G30.9, F02.80. C. F02.81, G30.9. D. G30.9, F02.81. Answer: D. G30.9, F02.81. This question involves coding mental and behavioral disorders specifically linked to an underlying neurological condition. The keywords are dementia with behavioral disturbance, due to, and Alzheimer's disease. ICD-10-CM guidelines for coding dementia associated with other diseases require coding the underlying neurological condition first, followed by the specific F code for the dementia and its behavioral disturbance. G30.9 is for Alzheimer's disease, unspecified, and F02.81 is for dementia in other diseases classified elsewhere with behavioral disturbance. Therefore, the code for Alzheimer's disease is sequenced before the code for dementia with behavioral disturbance. Question 16. A patient is diagnosed with bilateral moderate age-related nuclear cataracts. A. H25.12. B. H25.13. C. H25.11. D. H25.10. Answer: B. H25.13. This question tests coding with specific laterality. The keywords are bilateral, moderate age-related, and nuclear cataracts. When a condition affects both sides of the body, and ICD-10-CM provides specific codes for left, right, and bilateral, you must use the bilateral code if the documentation specifies both sides. H25.13 is the specific code for age-related nuclear cataract, bilateral. Always look for and use the most specific code available, including those that specify laterality. Question 17. A patient sustained a superficial foreign body of the left hand resulting in an abrasion. This is the initial encounter. A. S61.542A. B. S61.552A. C. S60.522A, W44.9XXA. D. W44.9XXA, S60.522A. Answer: B. S61.552A. This scenario involves coating an open wound with a foreign body. The keywords are superficial foreign body, left hand, abrasion, and initial encounter. ICD-10-CM codes for open wounds often incorporate whether a foreign body is present. An abrasion with a foreign body is classified under codes for open wounds. S61.552A is the specific code for open wound of left hand with foreign body, with abrasion, initial encounter. The code for the open wound with foreign body is sufficient and captures both elements. When a foreign body is present in an open wound, use the specific code for the open wound with foreign body. Question 18. A patient is admitted with acute appendicitis with perforation and generalized peritonitis. A. K35.2. B. K35.3. C. K35.80, R10.0. D. K35.3, K65.0. Answer: B. K35.3. This question requires the use of a combination code for multiple related conditions. The keywords are acute appendicitis, perforation, and generalized peritonitis. ICD-10-CM provides combination codes for acute appendicitis when it is associated with rupture, perforation, or gangrene, and resulting peritonitis. K35.3 is the specific combination code for acute appendicitis with perforation and generalized peritonitis. Using the combination code is the most accurate way to report this diagnosis. Question 19. A patient presents for routine screening for malignant neoplasm of the colon. The colonoscopy findings were normal. A. Z12.11, Z00.00. B. Z12.11. C. Z00.00. D. Z12.11, K63.5. Answer: B. Z12.11. This question tests coding for screening encounters. The keywords are routine screening, malignant neoplasm of the colon, and normal. When a patient receives a screening test for a specific disease and the results are normal or negative, the Z code for screening for that specific disease is the primary diagnosis. Z12.11 is the code for encounter for screening for malignant neoplasm of colon. Do not code the screening procedure itself, like colonoscopy, as the primary diagnosis, or codes for normal findings unless specifically instructed by a guideline. Question 20. A patient with a history of intravenous drug use is diagnosed with acute hepatitis C. A. B17.10. B. B17.10, F11.99. C. B17.10, Z79.89. D. B17.10, Z72.89. Answer: A. B17.10. This question involves coding an acute infectious disease and determining if a history code is necessary or appropriate for the current encounter. The keywords are acute hepatitis C and history of intravenous drug use. The primary diagnosis for the encounter is acute hepatitis C, B17.10. While the history of drug use is relevant medical history, it is not the condition being treated during this encounter and is not a current active substance abuse issue based on the documentation provided. Code the acute condition being treated, and only add history codes if they are relevant to the current encounter or treatment. Question 21. A patient has unstable angina pectoris with coronary atherosclerosis of native coronary artery. A. I20.0, I25.10. B. I25.10, I20.0. C. I25.700. D. I25.700, I20.0. Answer: A. I20.0, I25.10. This question involves coding angina pectoris associated with coronary artery disease. The keywords are unstable angina pectoris and coronary atherosclerosis of native coronary artery. ICD 10-CM guidelines instruct that when unstable angina is documented with coronary atherosclerosis, the code for unstable angina is sequenced first, followed by the code for the atherosclerosis. I20.0 is for unstable angina pectoris, and I25.10 is for atherosclerotic heart disease of native coronary artery without angina pectoris. Note that I25.10 specifies without angina, which might seem counterintuitive, but specific combination codes for atherosclerosis with angina are also available and should be checked. In this case, the documentation specifies both unstable angina and atherosclerosis, and separate codes are required with the angina coded first. Question 22. A patient presents with cellulitis of the right lower leg due to a spider bite. A. L03.116, W56.52XA. B. W56.52XA, L03.116. C. L03.116. D. L03.116, S80.919A. Answer: A. L03.116, W56.52XA. This scenario requires coding an infection resulting from an external cause. The keywords are cellulitis, right lower leg, due to, and spider bite. When an infection like cellulitis results from an external cause like an insect bite, you code the cellulitis first, followed by the external cause code specifying the event that caused the injury. L03.116 is the code for cellulitis of the right lower limb, and W56.52XA is for bitten by other non-venomous arthropod, initial encounter. Code the resulting condition, cellulitis, before the external cause of the injury. Question 23. A patient is diagnosed with sepsis due to a central venous catheter-related bloodstream infection. A. T80.211A, A41.9. B. A41.9, T80.211A. C. T80.211A, A49.1. D. A41.9. Answer: B. A41.9, T80.211A. This question involves coding sepsis related to a device. The keywords are sepsis, due to, and central venous catheter-related bloodstream infection. When sepsis is documented as being due to a specific infection site or cause, especially a device-related infection, the code for the sepsis, A41.9, sepsis, unspecified organism, is typically sequenced first, followed by the code identifying the site and nature of the infection related to the device, T80.211A, infection due to central venous catheter, initial encounter. Code sepsis first, then the specific cause or site if a combination code is not available. Question 24. A patient is seen for management of gestational diabetes mellitus, insulin-controlled, in the second trimester. A. O24.419. B. O24.419, Z79.4. C. O24.415, Z79.4. D. O24.415. Answer, C. O24.415, Z79.4. This question tests coding gestational diabetes with specific details about treatment and trimester. The keywords are gestational diabetes mellitus, insulin-controlled, and second trimester. ICD-10-CM requires coding gestational diabetes based on trimester and whether it is diet, insulin, or oral hypoglycemic controlled. O24.415 is the correct code for gestational diabetes mellitus, insulin-controlled, second trimester. Additionally, Z79.4 is required to indicate long-term, current, use of insulin. Remember to capture all specified details including trimester and type of control, and add the Z code for insulin use. Question 25. A patient undergoes excision of a malignant melanoma of the skin of the right upper back. A. C43.59, D49.2. B. C43.59. C. C44.501, C43.59. D. C43.59, Z85.52. Answer, B. C43.59. This question involves coding a malignant neoplasm. The keywords are malignant melanoma, skin, and right upper back. When coding a malignant neoplasm, you need to identify the histology, melanoma, and the site, skin, right upper back. C43.59 is the specific code for malignant melanoma of the skin of the back, unspecified site, which is the most appropriate code for the upper back. The C code for the malignant neoplasm is the primary code. Do not code uncertain behavior or secondary sites unless documented as such, and history codes are for past conditions, not the current one being treated.